Other news at this hour, a few organizations have vowed to challenge the implementation of the National Health Insurance Bill. This comes after the National Assembly passed the NHI Bill with 205 members of Parliament in support of it. The bill makes provision for one pool of healthcare funding for private and public healthcare providers, but the bill will now need to be passed by the National Council of Provinces, the NCOP, before it is signed into law by President Cyril Ramaphosa. According to the Health Department, the aim of the bill is to provide equitable access to quality healthcare services. So perhaps for this discussion, we are going to be joined by Dr Kgosi Letlape, who is a health activist. Dr Kgosi, a very good afternoon. Thank you for your time with us here on the SABC.
Good afternoon to you and to the viewers.
So obviously South Africa is committed to universal health care by 2030 as per the UN's SD goals. And the strategy is to obtain this through the NHI. At this point, with the passing of the bill by the NHI bill by the National Assembly, what is your take? Is South Africa ready for that rollout?
South Africa needs NHI yesterday.
Okay.
But the way it is being rolled out raises serious concerns. So I am a proponent of NHI. But if it's going to be NHI, it must be for all of us. What I will not accept is a third tier of the healthcare system, where you're creating a nationalized, low-cost medical aid. What the government should be doing, they should be leading by example, nationalizing PARMED and GEMS and all the other medical aids, and allowing all others to join at whatever rate they can afford in terms of whatever is determined. If it is national, it has to be for all of us. And the first person that needs to be signed up on national health is the head of state, the president, and Dr Cyril Ramaphosa, his cabinet, the judges, and all of us that are currently on medical aid. If it is not for all of us, it should not even be called national.
Dr Kgosi, thank you for those sentiments. I wonder if, as we look at the timing of the bill, do you think that the law reform processes are being rushed, given the political dynamics that are unfolding as we head into elections? And perhaps also we're looking at scenarios post-COVID, where we're still seeing recovery. And then with that said, I mean, there's obviously going to be impact to the Fiscus if the NHI is implemented. You've got load shedding that you're also contending with, and unemployment. Walk us through how those dynamics are also going to impact what's being proposed.
I think on the impact for the Fiscus, that should be neutral.
Okay.
Because NHI is funded by citizens. It's not funded by Treasury. It should just be pooling of resources, solidarity, and a common pool for all of us. Opposition members, ANC members, judiciary, legislature, privileged business people. It should be for all of us. So we should not worry about issues of pooling of resources. Okay. The issues that should concern us is the governance structure. This will probably be the biggest fund this country will ever see. It cannot be left to a Ministry of Health and to a Minister of Health to be the one that oversees it. The fund should be an independent Chapter 9 institution with its members elected on the basis of competence for the job that is required. And the process should be a parliamentary process of putting those people in, signed in by the head of state. It cannot be left to a ministry. And the other key issue is the fact that that fund should be able to purchase healthcare for all citizens from all providers. That would include public hospitals, the public sector, independent practitioners, private sector hospitals. As long as they are willing to be paid the agreed, negotiated tariffs, and South Africans should have a choice as to where they go for their care. Those should be the fundamental pillars of what we build going forward as a template for universal health coverage. Anything less, anything that is meant for the poor will become the new pot of honey for corruption. There should also be principles where we do not subscribe to current procurement mechanisms. We will do something similar to what the state did in terms of procuring vaccines. We will purchase as a nation, and we will not be a price taker, we'll be a price fixer. That way, we can afford to provide quality health care for all South Africans. But if it is not for all of us, if we don't start with those at the top, we should all be suspicious of what is happening. And we're saying, start with yourselves. If the president is not in there, don't take the poor person's money when you are going to a different healthcare system.
I'm so glad you've touched on that point, the issue of transparency related to the selection and procurement processes under the NHI and what concerns arise there. Because I wanted to look at the risks of medicine access as well. And again, as you alluded to, where the wealthier people are going to be able to bypass the NHI selection and purchase process, you know, where they have money to purchase more expensive medicines, etc., other than what is being procured by the state. So I wonder if it's going to live up to the intention of providing equal quality healthcare access to all at this point.
Yes, it will. We should not forget that the wide public healthcare system under apartheid did exactly what we hope to achieve through funding through a common pool of NHI. Prior to the new dispensation, if you were white and you were sick, you went to a public hospital. I remember when I grew up, there's a businessman called Tony Factor who owned half of downtown Johannesburg. He had his bypass surgery done in a public hospital. It's all about solidarity. It's all about all of us being in one boat. What we cannot do is to use post-apartheid architecture to continue having apartheid health in this country. Yes, it can be done. Yes, it will be of great quality. Yes, all of us should go in there. Remember, the Prime Minister of the UK had COVID. He was a conservative, and he went to the NHS for his healthcare. That's what we need. All people that are in public service have to use the public sector. There has to be a common funding for all South Africans. If that's the template that we build this NHI on, it's a template that will work. If all those that are in charge still go elsewhere for their healthcare, this will never happen, and we should not allow it, because it will discredit a process that all of us need, a reform that is well needed by this country and by this nation.
Dr. Kgosi Letlape, thank you for your time with us here on the SABC.